When you hurt your knee, there's different stages of healing. So if you're inflamed right now, you shouldn't be doing the same exercise that you'd be doing 6 weeks down the road when you're feeling better. So in this video, we're gonna break down each stage, what we should be doing and how we should challenge it during each period. Let's get into it. You tweaked your knee, so you're having sharp pain. So there's different areas that we have sharp pain in our knee. So it might be right here on the top. It might be right here on the bottom, just below the kneecap. Sometimes it's on the outside of the knee. That's typically early. Let me know, leave a comment and let me know if you want a video on exactly that. That one's pretty easy to do. This one right here, this is the majority of the time we see people with knee pain where it's on the inside of the knee and the front of the knee. But the inside of the knee and the front of the knee is patellofemoral pain syndrome. That's where we're having issues with our patella and the way it articulates with that joint and the muscle attachments in that area. We have a bunch of muscles right here that come down and attach on the back of the tibia, and that's called the pes anserine. So when muscles overlap each other, they start to get stuck together, and that's where you start having problems in that area, and it's really important to identify, and we'll do that in this video. It's very popular now to work knees over toes. There's a guy named Knees Over Toes guy. He is not a bad guy. He's actually a really good guy. I bought his program to see what he's doing because I had so many clients asking about it. And I don't like to put anybody down with their program unless I'm aware of all the information. What he tries to do is he tries to put together 5 different stages of an exercise program. So when he's actually loading the knees to build resiliency, which is a good thing at a certain stage. And then all of those exercises have their own 5 stages to it. The issue is the clients that we've seen where they've tried his program and they've gotten hurt is that they went straight to level 5. We have to start at the level that we should be at, and identifying that is very, very important. In the beginning of an injury, when you first hurt your knee, getting your knees over your toes is gonna cause you problems. So if you think about this like a ledge, so you think I have a little guy. So we have ropes. We have 4 ropes in our quad tendon. It's coming down. We have a little guy hanging off right here, and it's a little rope. If that guy's hanging off and it's sharp like this, then that's gonna cause a lot of irritation to the front of the knee. It's gonna fray that rope. If we get the knee back like this, it's not nearly as sharp. And that's how we need to think about it when we first hurt our knee. We want to take as much pressure off of it as possible so that we can get the healing process going. So in the beginning of a knee injury, we want to keep the knees behind the toes to take the stress off of it and allow the healing process to happen. Definitely the number one thing that we need to think about with the knee is glute development. If we don't have strong glutes, then our knees are going haywire. Our knee is a consequential joint. It moves forward and backward, but my hip does all of this stuff, right? And my ankle too. Now, if my hip is doing all this movement, if I don't have control at my hip, then my knee is at the consequences of what my hip can't do. So I've got to address that and make sure that I have really good glute development, and we can look at this glute muscle right here. It wraps around the side, just like this, wrapping around the side of my femur, and it pulls the knee out to the side. So it pulls it out to the side, and then when I'm loading and I'm against gravity, I'm using the glute to keep my knee behind my toes. Because when I bend over, I'm either using the glutes or I'm using my quads. We can't turn the quads off, so we've got to use the glutes just more, just a little bit more. We also have a hamstring pull. So now thinking about your knee like my pants. So all these muscles are wrapped together, right? So all these muscles are crossing each other. We have something in the body called fascia, and fascia is like a sandwich bag. It's around the muscle, under the muscle, in between the muscle and the skin. So all of those muscles have fascia around them. It looks white. So when we dissect bodies when we were in PT school, we'd see yellow, that was fat. We'd see red, which was muscle, and then we'd see white, which is either a tendon or a ligament or fascia. And fascia is kind of like a spider web, right? It's everywhere. And so that's what we saw. And most people didn't pay attention to it, but I was exposed to it when I was younger. So I was like, oh, this is what fascia looks like. So it's this inner webbing between these muscles. And what happens when these muscles cross each other right here, all of them, but these muscles right here, we have fascial connections between them, and they start to get stuck. It doesn't have a lot of blood flow to it. So they start to get stuck together, and that tightness starts to pull, and it'll pull pull all the way around. So the way that I think about it is like my pants. If I start pulling on the back of my pants, you see how it tightens up the front of the leg. And that's where we get a hamstring pull. So there's a secret. If you're having pain where it feels like a vice is gripping around your knee and you grab that hamstring, if you grab that hamstring right here and you start stripping out that tissue aggressively, that's typically going to get rid of it. You do for about 1 minute, just digging this out, that's going to get rid of that pain. We've seen that consistently. It's an easy fix. But just in general, knowing that the hamstrings being really tight will pull on the front of the knee and cause pain on the front of the knee is really important, because all of these pain processes, all the pain patterns are three-dimensional, and we have to know that if we're going to actually get you long-lasting solutions to your problem. Now also you have a calf pull. So when we look at the hamstring and the calf right here, the hamstring comes down, crosses the knee, and then the calf comes up and crosses the knee. So where that happens, we get fascial connections again. So muscles are crossing each other and they're like ropes stuck together. So you can imagine if you had these muscles were all stuck together with fascia, you got to pull back here, you can't straighten your knee out. If you have a problem with straightening your knee out, leave us a comment and let us know so that we can give you some specific things to do for that. Along with the calf pull, we're gonna have ankle mobility problems. So when we're walking, we need to be able to get the ankle to go into dorsiflexion and bend right here. The knee has to get straight and the glute has to fire. That's called triple extension. So I'm pushing off of my toe, I'm pushing off of my knee, and I'm pushing off of my glute. Triple extension is something that's essential for walking and for running. That takes stress off of our foot and ankle. If we're losing dorsiflexion, that's gonna be a problem for us. So if I don't have enough bend in this ankle, dorsiflexion is coming up. If I don't have enough bend in this ankle, then my knee's gonna have to bend early, and then I consistently have pressure on my knee, and that's going to cause me a problem. So I want to make sure that I have good dorsiflexion, but that has to do with the joint mechanics and the muscle tissue. And a lot of times when you go to physical therapy, they pay attention to the joint mechanics, but they don't pay attention to the muscle tissue. And if we don't adjust the muscle tissue, if we don't address that, then we're going to end up having problems long term. We have tools right here, and we have a lot of videos on this that go more specific into it, but it's really important that you know exactly what to do. So knowing all this anatomy and what's happening with the knee is important, because if you don't know why you're doing it, then they're probably not going to do it. So we have tools. We have a lacrosse ball. We have this Mobo. It's a fantastic tool. I enjoy using it. I have 3 of them because it travels with me everywhere. It has so much versatility is what's important. And then a rolling pin. So the Mobo just kind of covers all that stuff. But what we have to do is we have to loosen up muscles. If we have fascia that's holding muscles together, they're not able to glide across each other, then we have to break up those muscles where they're getting hunked up together. Now, once we get that glide, then we use the muscle, and that's where exercise comes in. So we will always have a mobility component. We'll have 3 components to an exercise routine that we need to do consistently. We'll have a mobility component, we'll have a stability component, and then we'll have a movement pattern change. So we want to load the joints differently. We want to take pressure off of the knee and redistribute that load to the glutes. There's a guy out of LA that does a lot of research on this about, I think his name's Chris Powers. He looks at the glutes and he looks at a brain scan and says the more that we sit, the more our glutes turn off, and they coined it as glute amnesia. If the glutes turn off, then we're going to use our quads all the time. We have to get our glutes fired up. So to do that, the most effective way is actually to take a lacrosse ball, one of these tools, and dig into this area where muscles are overlapping right here. Dig into this area, grind into it aggressively where it's a little bit painful, not too much, but a little bit painful. Grind into it, and then use the muscles. We do a hip hinge, we do clamshells, we do sideline leg raise. We'll do a single leg stance toe tap where I'm stabilizing my knee and firing that glute with my chest down a little bit, but I can feel that firing in my glute. Typically what we see is it takes 2 to 3 weeks to fire those muscles up. But the first thing that we have to do is get mobility in that glute, get those muscles gliding around, and then we fire them up. Second, we need to loosen up the hamstring. So we have a chain of tissue. Anatomy Trains talks about how our body's a pulley system. So they got slabs of tissue, they throw out on the ground. The bottom of our foot is attached to the calf, attached to the hamstring, because they have fascial connections. So we need to loosen up these hamstrings. We do it typically in the muscle belly right here. So we'll break up this tissue right here, break up this tissue right here, break up the tissue right here, loosen that up. We're gonna get more movement from the muscle belly. So typically I'll do that on a table and just glide that out, just loosening up that muscle tissue before I use it, so then I can use it more effectively. Next, we need to work on the calf. We got to break up that calf tissue. We know that this calf and the hamstrings are crossing each other, so we need to loosen up that hamstring and then loosen up the calf. We'll take, you don't get much leverage with the lacrosse ball, so what I'll do is grab this Mobo. It's probably the best tool for this. I'll get up on a bench, probably something lower than this or a chair, and I got the pressure from my hamstring or my thigh pressing down into the calf, and then I'll just glide into that calf tissue, and I'll move that calf around. And I'll do about 10 swipes in the inside, in the middle, and on the outside, loosening that up. And at the end, I'll go down all the way right here, loosening that up. So I've got to loosen up that calf tissue if I'm going to use that muscle effectively. By loosening up the calves, I should increase mobility in the ankle. If you want a video specifically on joint mobilizations, then we can do that. Just let us know in the comments. But loosening up the calf should be helpful, and then strengthening those muscles. Most muscles are tight because they're not strong. They're clinging on for dear life. They're stiff. We've got to loosen up those muscles and then use them. We do that consistently, and we loosen that whole chain up. Movement patterns. Movement patterns are so important, especially with our stages of healing. So first 6 weeks, we got to get out of that pain pattern. We got to load up the glutes. We got to fire all these muscles. So it's really important we keep the knees behind the toes and outside the second toe. So if I'm looking at my left knee, I want it to be behind the toes as I do a hip hinge squat, and then I want it to be outside the second toe as I drive down as well. If I'm doing that, then I'm keeping my knee in a good pattern. If my knee is going inside the second toe, I'm putting a lot of pressure on the inside of the knee, and I'm just getting shear stress. I'm getting irritation on the inside of that knee. That's going to cause us problems. It's going to increase our inflammation, and it's going to slow down our healing process. For the first 2 weeks, we're going to get 50% healing if we don't re-injure it. In the first 6 weeks, we're going to get 80% healing, and then at 12 weeks, we get 100% healing. So everything we think should happen faster than it actually does, and I want to make sure that you're being realistic with what it takes. If you're having chronic knee problems, then we have to give our body time to adjust. We got to build up those muscles. We got to break them down, loosen them up so they can glide, then fire them up, and then keep good movement patterns. We do that consistently, you're going to continue to feel better. When you get to the resilient stage, it's really important that we start doing exercises that are somewhat benign. They don't cause us problems, but we are working on putting on the brakes. So when I am slowing myself down, I put on the brakes. I'm slowing down, and that's where a lot of people have weakness, and their knee starts to twist inward and goes way in front of the toes. So a good exercise that doesn't cause pain, doesn't get us way in front of the toes, it's kind of a transition type exercise, is walking backward on a treadmill. And knees over toes guy talks about this, that we walk backward on a treadmill. He typically uses a sled and walks backward, but that's putting on the brakes. So we're doing a reverse action and we're slowing ourselves down, and we've got to work on that in the resilient stage. So 6 to 12 weeks, we start walking backward on a treadmill. If it causes any pain, it's too early to do it. So we can test that out. I typically do 3-minute sets, but you can go up to 10 minutes. It's going to burn your quads. We want that burning, but we don't want the pain. When you do exercises in the gym, it's very important that unless you're working on resilience of the knee and you're not having pain, then we should have our knees behind our toes. We should have them outside the second toe. Nobody's going to convince me that that's wrong, because we have so much success with our clients here at the clinic. We teach them to do that because they're always forcing movement to happen from their hips. They're firing up their glutes, and it's hard to turn off your quads. You really can't do it. Your quads are going to work all the time, so we need to be focused on working our glutes all the time when we're in the gym. If you're doing that, then your quads and your glutes are going to fire, but your quads aren't going to be over dominant. And you can only ensure that you're using your glutes when you're in standing with exercises if you're shifting your hips back and you're keeping your knees behind your toes. Then you should be dominant with your glutes. And if you do that consistently, you're going to have a life without knee pain. And that's the goal. Make sure to hit the subscribe button, hit the bell icon so you don't miss out on any videos. Also check out our videos. We have do's and don'ts of the knee, which is really important, and then also a specific video on pickleball and knee injuries, because we see that all the time. Get mobile and stay active.